hypertension, diabetes, things that you wouldn't normally think about like anxiety, depression, all of that stuff goes up. So you're taking a handful of pills for the rest of your life as opposed to a single injection that helps your knees work better, for example, and then you can keep up.
Hey guys, welcome to the Naked Doctor Show. I'm Dr. Tammy.
And I'm Melody.
We have a great show for you today, of course, as usual. And I am so happy, if you have not met Melody yet, she's an amazing nurse practitioner that just joined our practice. And it's just been just a pleasure, and just I had no idea how many amazing things that she has done and can do. It was just sort of one of those magic moments that it just felt right, and I was like, hey, come forward. And I'm just constantly amazed. So just so many blessings that she's just here.
Thank you so much.
Love it, love it. So tell us a little bit about yourself. And our show today, we're going to be talking about regenerative medicine, which is sort of your jam too.
Oh yeah, super exciting field. So I have over 20 years of healthcare experience. I started off at the University of Arkansas, going there for my bachelor's degree in nursing. I got my RN license and then my master's degree in nursing, family nurse practitioner license. I've worked in neonatal intensive care, labor and delivery, urgent care, emergency room. Most recently, I've been getting into the field of regenerative medicine, which is super exciting. We have some new and ethically sourced technologies that allow your body to be able to heal itself. It helps people to avoid things like joint replacement surgery, which is huge, right? So really, really exciting to even be involved in this cutting edge state-of-the-art type stuff that we're able to do here now in Arkansas of all places. So I'm just pleased as punch to be here. I love it.
Hey, me too. So joint pain is one of the main things that we treat. And you mentioned like surgery and avoiding that. And we just had a patient this morning that was looking at shoulder surgery, and our orthopedic surgeon said, you know, that's the only option for you. And so she really wanted to explore other options. So.
Absolutely. And there are over 20 million adults in the United States that experience joint pain, and that's according to a recent survey by the University of Michigan. But it's a worldwide problem, right? If you don't have joint pain now, you probably will at some point in time, just because our bodies as humans wear out over time. And there are certain things that you can do that even speed up that process. A lot of high school injuries end up becoming joint pain later on in life as those joints continue to deteriorate. So the fact that we can help to treat these things without having to do something as invasive as surgery, or that requires the downtime, the pain medications, the infection risk. So really, really big that we're able to treat stuff like this in a very quick, outpatient, super easy type manner. So yeah.
Oh, no, we just did an IV one this morning too.
We did.
And they were in and out so fast. It was nuts. I looked at you and I'm like, are they done already? And you're like, yeah, they're done already. So they're in and out the door, and just amazing. They're saying it's time for a little break. So we're going to come right back and we're going to talk more about regenerative medicine. If you have joint pain, or you even have systemic disease, Parkinson's, Alzheimer's, autoimmune, you know, we're not saying we're curing anything, but hopefully we could certainly have an impact on the process and help you get your life back. So we're going to talk more about that, so you want to stay tuned.
When I was about 50 years old, I started gaining weight. I never suspected hormones. I didn't know what it was. I tried to cut back on eating. That really didn't work. And when I was about 58, I came home from work one day and my husband had watched Dr. Tammy on television. He had never watched her before, and was telling me about hormones and what she was talking about, how it played into weight gain, and suggested that I visit her. I tried that, and along with her carb melt, I took that. I have lost 27 pounds, and I feel great. I get compliments. People ask me, what did you do? And I always tell them about Dr. Tammy and the hormones and the carb melt. It seemed to be very effective for me.
Hi, welcome back to the Naked Doctor Show. I'm Dr. Tammy.
And I'm Melody. Hey.
And we are talking about regenerative medicine today, and it's a very interesting field. I just talked to someone the other day, and they're in Florida, and they said, oh, it's really big there. All the elderly population retired, and like you said, they did sports or whatever when they were young, and now they're looking at knee replacements and shoulder replacements, and so if they can avoid surgery, that's a really big deal. I thought it was funny, one of the patients we had this morning, she was in and out, she got her shoulder injection and was leaving, and you're like, that's better than surgery, and she was like, oh heck yeah.
Right.
Yeah, so some of the experiences you've had, and again, like when you were just talking the other day, I was teasing that I just chose you based on you walked in the door and you're amazing, and I just felt really good about it. But just massive experience, years of doing this and thousands of procedures that you've done. That's nuts. I mean, I've done PRP for a while and PRF and some of the regenerative donor cells as well. But, it's just that kind of experience. I mean, I've been, like my day job, hormones doing mostly. So having that kind of experience brought to us is just amazing. But
yeah, I've done over 5,000 of these types of procedures over the past 5 years or so. So it's definitely something I'm very experienced in doing, and I absolutely love to do. It's actually kind of a personal cause for me. My dad was addicted to narcotic pain medication for over 20 years because of back pain. And when he made the very difficult decision to get off of those medications, it cost him far more out of pocket to stop taking narcotics than it would have cost him to stay on the narcotics for the rest of his life. And as a healthcare professional, that breaks my heart. As a daughter, it breaks my heart. Just watching all the changes that happened in his life, the way he interacted with people, like his life became all about, when am I going to be able to get my medicine? Am I going to have enough? I don't want to have any pain. So anything that I can do as a provider to help people be able to avoid that mess completely, absolutely, I'm going to do it. The issue is when you go to a traditional doctor with joint pain, there's a very specific pathway that's recommended by the American Academy of Family Physicians that you have to go down. So somebody shows up with joint pain, the very first thing we do is, well, here's some anti-inflammatory medications. And if that doesn't work, then they give you steroids. The issue with anti-inflammatories is over time, they don't work as well, and they also start tearing up your stomach, especially if you're on them long term. When you get into things like steroid injections, the way a steroid works is it temporarily reduces the inflammation in that area, which on the front end sounds great, right? Because inflammation hurts and nobody wants to hurt. But big picture, inflammation is your body's way of letting your brain know that if I keep doing what I'm doing, I'm going to cause further damage to this joint. So what happens when you get that steroid injection in your knee, for example? You go out and you do all these things you wouldn't normally be able to do because it feels great, right? But what you're actually doing is causing further damage to that knee so that when that steroid wears off, your knee is worse off than it was to begin with. So you keep on getting steroid injections, and the first one works great. The second one doesn't work as good. The third one might not work at all, right? And then after that, what choice are you left with? Well, the next step on that pathway is going to be surgery. And if you are one of those people who likes to look up YouTube videos and whatnot, there are videos of surgeries online. If you have a squeamish stomach at all, please don't look any of these up because they do get pretty graphic and pretty scary looking, quite honestly. When you go in for a joint surgery, you also have to think about all of the infection risk. The hardware that they put in during joint surgeries only lasts about 10 to 15 years. So if you're super young and you need a knee replacement, you're going to look at multiple knee replacements over your lifetime as that hardware continues to wear out. So what's so exciting to me about the products that we have is that it helps your body actually rebuild that cushioning and that tissue that has been lost and worn out over time so that you don't need to have that surgery. So super duper fun, right? And over my career in this field, I've seen people that have knees that are literally bone on bone, look like this, and 90 days after one single injection, that tissue regrows. So you have a much greater range of motion there with much less pain. Gives them their life back. I've seen people be able to say goodbye to their walkers, be able to throw their cane away. And one really big thing to think about is that joint pain in of itself is exhausting, but if you can't move the way that you want to, if you can't keep up with your grandkids on that beach vacation and walk through the sand because your knees and your hips and your ankles hurt so bad, if you can't get the exercise that you want to, the incidence of all of these chronic conditions like hypertension, diabetes, things that you wouldn't normally think about like anxiety, depression, all of that stuff goes up. So you're taking a handful of pills for the rest of your life as opposed to a single injection that helps your knees work better, for example, and then you can keep up, you can do all the things you want to do, you can get the exercise that you need to get to keep your heart healthy, to keep the rest of your body healthy. To me, it just makes sense.
And I would be super skeptical if I were you out there and thinking, I don't know about that. Because it sounds too good to be true.
Honestly, when I got into this field, that's the very first thing that I thought. I was called for an interview, and I went in and I said, okay, do you have case studies? Do you have testimonials? Do you have the research behind this? And this clinic that I worked at initially, yeah, they were able to produce all of that stuff for me. So it actually started with a research study in that clinic, and it worked so well that the clinic chose to keep those services on. So I personally, in the 5,000 plus cases that I've done, I've seen evidence that we can measure on x-ray how quickly and how effective these particular injections are. So it is very ethically sourced. We're not going to use anything that has any kind of negative ethical association with it, because I want to make sure that I'm doing something that I'm comfortable with and that my patients are comfortable with. I don't want to offer anybody anything that they don't agree with at all. So.
Mm-hmm. I think that's interesting too, because I did PRP, which is platelet-rich plasma, which is a regenerative injection, but we're using your blood and we spin it down and we get all the factors and everything that we want and the cells that we want to help regenerate, and had great results with that. And then I had a patient at one time, a back pain patient, who had an injury and asked me about the allograft cells. And I do want to say too, kind of just interject there, that we're being very careful about what we're saying, because some clinics will say that there's a certain procedure that they're doing, and we won't say that word, but there's a buzz. So we're talking about allograft cells, which are what notoriously has been used in the past. But anyway, this patient said, can you get the donor stem cells, the way he said? And I was like, well, let me do some research. So I found a company, and they were also very careful to say to me, because we want to do it safely, but we also don't want to make somebody think that we're doing something that we're not. Because there are stem cells in PRP, in the plasma. There are stem cells in these allograft tissues, but there's a lot more of those in the allograft tissues than there is in our blood, especially as we age a little bit. So we don't really want to say we're giving stem cells. That's kind of a dirty word, because it's just a part of it, because there's other cells in there, and we want to make sure that we're compliant with what we're telling patients. So you know so much more about this, but it's so cool, because what we're using is allograft tissue, which comes from umbilical cord, which the term Wharton's jelly, you can look that up. It kind of sounds like jam or something. I'm like, really?
It does not go in a peanut butter and jelly sandwich.
It's not. But it is that thick, gooey substance from the umbilical cord. So when you say ethically sourced, and you can speak more to that, the way they get it is from live, healthy births from moms, and they are tested, and people always ask if there's a risk of rejection, and it's just that those cells are not genetically predetermined yet, so there's no rejection. I think people are sometimes a little bit more where they want to do their own blood, but there just comes a point where age, time, our bone marrow is just not as productive as it once was, and so then we get into looking for those donor babies fresh, ready to go, make new joints, make new disc space in the back, and so many things. So
Sure. Yeah, and by FDA definitions, a stem cell shot can only contain stem cells and absolutely nothing else. So by FDA definitions, these products could only come from fat tissue, umbilical cord, blood, or bone marrow, and those are not the types of products that we use. The product that we use does contain live active stem cells, but it also contains other growth factors, proteins, enzymes, exosomes, hyaluronic acid, just all this great stuff that helps your body to rebuild the soft tissues. So super exciting there that we can get that, and it's an ethical source. These are all term C-section live birth deliveries, so not associated at all whatsoever with abortion. And then that Wharton's jelly, it's the cushioning that's in that umbilical cord that helps protect the baby's blood flow as the baby's developing. And this is something that hospitals normally throw away at the end of a C-section. So the fact that we've figured
breaks my heart. It's like throwing away food.
It's such like good stuff. It's amazing. So yeah, the fact that we can source these products ethically, nobody has to get hurt. It's not associated with abortion. It's amazing. But then in addition to that, that tissue, there's no maternal DNA in that tissue, nor is there any baby DNA in that tissue. So what that means for the patient is that there's no risk of a rejection reaction, like you might see with a blood transfusion or an organ transplant, and you have to know what your blood type is and you have to get matched and all that. Not an issue with these products, because there's not that foreign DNA that your body's going to be detecting and rejecting. So as far as tissue transplants, it's one of the safest ones that you can possibly do. All of these mothers are very carefully screened for communicable diseases. The tissue itself is tested to make sure that there's nothing in there that doesn't belong in there. So again, super duper safe as far as any kind of tissue transplant goes. It's a really, really good one.
So yes, I just think it's important that you do your research, look around, talk to people, go for appointments, go for second opinions, and make sure that you feel good about what they're telling you. And if they're telling you certain things and they're promising you certain things, that you have to be your own advocate sometimes and make sure.
Absolutely. And wherever you're going for these types of injections, make sure to ask the clinic where they source their products from, because you want to make sure that it is a very ethically sourced product and that there's nothing foreign in there, that there's no kind of diseases in there. So with the company that we use, we can actually show you the individual lot numbers and they'll tell you everything that they've tested for and that everything was negative. So very, very safe.
Love it. Okay, they're saying it's time for a little break, so we're going to take a little break and we'll be right back, and we're going to talk about a few other types of regenerative therapy, just, even more than what we're doing with the donor cells and what we do with PRP. So hang tight, we'll be right back.
In 2007, I was in an auto accident. A lady ran a red light and hit us, and I got a traumatic brain injury, and I got herniated and collapsed and compressed discs in my upper and lower back. I also fell down the stairs at work years ago, like 20-some years ago, and I had an ankle injury. The day that I was supposed to have my consult with the surgeon so that I could have surgery done on it, I had called over here and I got an appointment with Dr. Tammy. I was more excited to come in and have something actually done for it that didn't require surgery and a bunch of downtime. Up until that, I had been completely on the cane. I couldn't get around without the cane because it was that bad. And she put an injection in the front and one on each side, and that night I was off the cane. By the time I got home, I didn't need the cane anymore, and I haven't used it since. And my back, where I've got all the disc issues and things, I haven't had any pain in it. It's been awesome. And it's like they keep working for 3 months, and I'm just so excited to see, okay, in 3 months, if it's this different and amazing already, what's it going to be in 3 months?
Hi, welcome back to The Naked Doctor. I'm Dr. Tammy.
I'm Melody. Hey.
Today we are talking about regenerative medicine, and it's sort of a buzzword that gets a lot of attraction because people do want to avoid surgery, they do want to feel better, and they don't want to have surgery and they don't want to hurt. And like you said, all the complications that can come in different disease processes. And to me, I would not keep doing something that doesn't work. So I've been doing mostly PRF because it's easy and we can get it from people's own blood, and they are concerned about donor cells and what that is, or what am I going to get, or do we know that this is safe? And we have really good results. And you mentioned like 65 is the cutoff. So I've always kind of told people that, if you're over 65, we really need to start talking about, another option, because you just don't have that concentration of the factors and healing factors and things that, that you had mentioned to me. So, yeah, when they come, mostly what I've done previously is PRF. So I'm so excited that Melody brings this whole world of her understanding and knowledge with the options that we have as well. So, yeah.
Yeah, let's unpack some of those differences there. So PRF stands for platelet-rich fibrin. This is a procedure where we draw your blood, we spin it down to the natural growth and healing factors from your system, and we inject that concentrated product into your joints. Why in the world would anyone want to do that? Well, I'm glad you asked. Here's why.
Glad you asked.
Right. The inside of a joint, where all your cartilage and your cushioning lives, it doesn't have a lot of blood flow. It gets nutrients through the joint fluid that's in there, but there's not a lot of blood flow on the inside of a joint. So when you skin your knee on the outside, for example, you bleed at that site. That actually releases chemicals that get picked up by your bloodstream and carried throughout your body to bring your body's natural healing abilities back to that area so you can make some new skin to cover that wound. Because the inside of a joint space does not have a lot of blood flow, then as this cartilage and cushioning gets broken down and worn out over time, there's never a signal that goes out to the rest of the body that says, hey, come fix this. So what we're doing is we're isolating that signal from your own bloodstream, and then we're injecting that signal and those growth and healing factors directly to the inside of the joint to call your body's healing abilities to the inside of that joint so that you can repair the cartilage or the cushioning that should be there. Now, the issue with PRF is that the results of this injection are only going to be as good as the healing system of the host. In other words,
great point.
If you happen to be like X-Men Wolverine and you heal very quickly from any illness or injury, right, this is a great procedure for you and we expect excellent results. But if you are not like X-Men Wolverine and it takes you a long time to heal from illnesses or injuries, then you might have a lower number of those growth and healing factors in your system. Also, if you have a lot of other complicated and chronic medical issues that your immune system is fighting, like if you're an uncontrolled diabetic, or if you have a super chronic lung disease and you're getting infections very frequently, then probably your healing factors are so busy working on all these other things that you're not really going to have that great of a result if we inject concentrated factors into your knee. A lot of people ask me, how can I tell how good my healing factors are? Well, the test for that is more pricey than the PRF injection itself. So it's kind of counterintuitive to test that beforehand, which is why we ask those questions. Do you heal very quickly? Do you have a lot of chronic illnesses? And then age is going to be a factor. As humans, after the age of 65, our number of growth and healing factors goes down exponentially. That's why we age, and that's why it takes you longer to heal from illnesses or injuries the older that you get. So if you're choosing PRF, it's a great choice if your immune system is awesome. If you are under the age of 65, I would expect an excellent result. But if you have a lot of chronic medical conditions, if you happen to be older in age, then you might want a different option. And the umbilical allograft that we offer is a great option for those people. Very, very high, like in the millions of these natural growth and healing factors. It's far more concentrated than what we can harvest from your blood. With that particular product, I've actually successfully treated a patient as old as 101 years old.
Oh, wow.
Yeah. And she was so fascinating. She was such a gem to have in clinic, and just to sit down and talk with her for a couple minutes was a treat. But yeah, I treated both of her knees and she had excellent results. And if we'd tried that with her blood, not very likely that we would have gotten much of a result from that just because of her age, really. But with the umbilical allograft, man, her knees did awesome. So it was so much fun to meet her.
That's awesome. It's my understanding that if you die of old age, really what you die of eventually is bone marrow failure, because your bone marrow just doesn't make stem cells anymore, and you can't regrow and you can't fight infection, and usually they get pneumonia or something like that and it takes them out. But yeah, over 100 is just amazing because environmentally we're exposed to so many things, and
Yeah.
I think you have to just kind of chalk that up to good genetics sometimes.
Absolutely.
I think that is really part of it, that you listen to them and you have these conversations and you have informed consent and you explain what you're doing, because there's just not enough of that. And I think it's just really important as part of their healing process that we get to take the time to meet them and know them. And
Absolutely.
even their families and about their life and their pets and their cats. And it's part of it when we're doing healing in medicine, it's a relationship.
It is. And it's a partnership, really. It's not just us throwing treatments at you. We want to know where you're coming from, what your symptoms are, how you got this way. And that's part of the way that we do things here, because we really want to drill down and figure out what the root problem is instead of just giving you something to cover up a symptom.
Yep. That's our jam. All right, it's time for a little break. We'll be right back. Hi, we're back. Today we are talking about regenerative medicine, and it encompasses so much. It's just really, we talk a lot about injections because it's exciting and we get such good results, and I always hate hurting people, but I always know when I go to stick a needle in, that's going to be the most beneficial thing that I can do, really. And so people tease me, I stick a lot of needles in people. You more than me. I mean, wow. But there's so many other things too that we can offer. And really, when you have a practice where you can look at the whole person and have that relationship. You can talk to them about different things. So we have hyperbaric oxygen therapy, which can increase your body's own natural stem cell production by over 800%, which is nuts. So if we do a therapy like that and we add some hyperbaric in there, wow, the results you can get even more. We have shockwave therapy, which can break up adhesions and scar tissue and joints. And we're just a holistic practice in general. And that kind of gets a weird, what is holistic? But to me, holistic is integrative, where you look at things. And I think integrative sort of is replacing the word holistic, because we get a little woo-woo out there. But everything I do is, I got to have research. I got to have nerdy science behind it, and I got to know. But also the integrative part is, are they overweight? Are they hormone imbalances? You know, aging has a lot to do with our hormone decline. You know, what do they need?
Absolutely. Well, and people think about weight as how you look in a bikini, and it's so much more than that. And we're not shaming anybody's body type at all. Beauty comes in all shapes and sizes, right? But from a medical standpoint, it's my job to help you be the healthiest that you can possibly be. And if you are built on the frame of a Honda Civic and you're trying to pull a semi-truckload full of weight, of course your Honda Civic is going to break down faster, right? If you think about your body the same way, for every 1 pound that you are over your ideal body weight, that's 4 pounds of extra pressure on your knees when you're just standing there doing nothing. And then when you do stuff like go up or down stairs, which increases it exponentially, or squatting down and having to get back up, it causes your joints to wear out so much faster. So if we can just help you maintain a healthier body weight, it's going to help your joint pain, it's going to help your heart health, it's going to help pretty much every system in your body, which, you know, with the integrative approach, everything is all connected, right? So we can't just treat your knees and then say, forget about the rest of you, right? It's all connected. We got to treat the whole person.
And a lot too is inflammation. Oh, it's all inflammation. And so if we don't address diet and exercise, which you can't exercise if you're hurting, but if we don't address all those pieces, if you're eating a diet that's full of junk food and preservatives, you're going to increase your inflammatory response as well. So I think that's really important that people realize that, and even if you get good results, and most people do, or you wouldn't have kept doing like thousands of cases, I think they still have to focus, or they're just going to re-injure, or they're just going to keep wearing that down. And then, you know, it's a bit of an investment, but hey, what is surgery?
Oh my goodness.
You know.
Well, and with surgery, it's not just the surgery itself, it's the time off of work, the time having to go to rehab afterwards, the infection risk, all the medications that you have to have afterwards. Like, everybody thinks about surgery as, oh, it's just this one-time thing, but you got to think big picture with this, right? And if you get a regenerative injection as opposed to surgery, your time off work is one simple appointment, right? Infection risk is so much less from one little needle stick as opposed to having your entire knee cut open.
You've seen those horror stories of infections.
Right? And then you don't have to worry about hardware that's going to wear out in 10 to 15 years and having repeat surgery. So just, it seems like a much easier option for many people.
Yeah, what do we say, no-brainer? So if this is something that interests you, just come and talk with us. Spend some time with Melody. She's amazing. She's just an encyclopedia. It's great. But if this is something that interests you, you can go to our website and we have lots of these videos on YouTube. You can educate yourself more, and we'd love to visit with you and make you part of our family.
Bring it on. We love meeting new people. So we'd love to help take care of you and help you live a better and a happier life.
See you next week. Love you very much. Mwah.